Dr. Jennifer Teasdale, day 1 of our core challenge. We are going to start by just addressing the basic principles so that we can learn about alignment and intra-abdominal pressure. So the first thing we're going to talk about is alignment. In any instance, whether we're standing, we're sitting, or we're laying flat, we want our rib cage over top of our pelvis. This is just basic alignment. And the reason for that is because our diaphragm needs to sit on top of our pelvic floor in order for our core to function properly. So just so we have a really basic understanding, diaphragm, top of pelvic floor, and then abdominal wall all the way into our low back muscles. So imagine a pop can, or for some of you, a can of wine. Those ones just came out recently, so maybe imagine that. So alignment first, and then the second thing we're going to talk about is intra-abdominal pressure, and we create that through breathing. And when we talk about breathing, a lot of people want to call it belly breathing, but it's so much more than belly breathing. It's breathing into a 360-degree pattern. So it's breathing into the belly, into the rib cage outwards, and into the back backwards as well. So a 360-degree breathing pattern. And when we do that, we create intra-abdominal pressure. So just a really quick exercise so you can feel intra-abdominal pressure, and then I'll show you the first exercise of today. All right, so we're going to place our feet on the wall, and we're going to check in with our alignment in terms of our rib cage and our pelvis. So our feet are together, our knees are out, and we're neither lifted through the rib cage, nor are we really dipping and diving deep into the rib cage. It's in alignment with your pelvis. Your knees are out so that you can't access your hip flexors. So your knees are in external rotation. When you take your knees out into external rotation, you start to use a little bit more hamstring and a little bit more glute, which is not a bad thing when it comes to your core. And then we're going to take our hands just inside of our hip bones, and from here you're going to feel your breath not just into your fingers, but you're going to feel your breath into your rib cage and into your low back. So you're going to take a nice deep inhale and an exhale. So if your diaphragm and your pelvic floor are stacked up, as you inhale, you should feel your pelvic floor relax and move sort of towards the wall. And when you exhale, you should feel your pelvic floor coming up towards your diaphragm, which should feel like a Kegel. You also should be breathing into your low back too. So just do a quick check here. And for a lot of us, we're not going to feel like we're breathing into our low back. And if that's the case, you stay here. Stay here with your feet on the wall and really focus on getting that 360-degree breath into your low back. That's incredibly important. The reason it's important is because it's stabilizing your spine. And without spinal stability, we're going to be at risk for a lot of other injuries. For the others of us ready to move on, you're just going to pull your feet back from the wall so you can feel what intra-abdominal pressure feels like. So if you just take your feet back, feet are together, knees are out, the wall isn't supporting you, you start to feel this pressurized system inside that canister or that wine can or that beer can or that pop can. And once you have that pressurized system, I want you guys to take a look at whether you're coning through the center of your abs or if you're tenting up. And if you are, you need to place your feet back onto the wall. And if you're not, you can stay right here. So feet together and knees out. Maybe hands here. And once again, can you breathe all the way 360 degrees into your low back, into your belly, into your pelvic floor. Awesome. And then if you can, maybe you're going to reach your arms up. That's 4 minutes. And this is where you're going to stay. And there's one other thing that I want to show you guys. Will you let me use baby Ami to show? Okay, so I'm going to grab a baby because he's going to allow me to have a little bit more tension through our core. So this is going to be for your really fit mamas or you really fit individuals. Hi, baby. This is Ami, everybody. Isn't he just the cutest? Yeah, he's learning to clap. Okay, so if we need a little bit of more tension or a little bit more load, you can take your kiddo if you have one. Hi, buddy. Feet together, knees out. Yeah, you sure you're clapping? Yeah. And you can lift. So now, how much does he weigh?
20.
So now I've got 20 pounds of load. That's definitely creating intra-abdominal pressure. Hello. And it's moving, so it also makes it a little bit more challenging. Yeah.